we're going to go over the navicular sling taping today. This is a great way to help decrease how much work the foot muscles and lower leg muscles have to do while you're rehabbing from plantar fasciitis, Achilles issues, or posterior tibialis tendon issues. So this would be used in conjunction with the other exercises and interventions that your physical therapist is having you do. So this is a little reference for Creekside physical therapy patients. If you're not a patient with us, check with your doc or PT before trying this taping method on your own. To do this, we're going to measure the length of tape that we need. We're going to measure with a non-sticky side of the tape. We're going to check from this middle outside bottom of the arch to the midsection of the top of the foot. We'll tear that piece of tape off. You want to make sure you have no lotion or skin oils on the bottom of your foot, so some rubbing alcohol or Dawn dish soap works awesome for that. And then there's two ways to apply the tape to the foot. So the first one involves some foot coordination. So what we're going to do is anchor the tape in this position here. So you don't want it on the outside of the foot, but you want as close to that callus on the outside of the foot as possible. And then you're going to have your ankle in the upward position towards your knee. You're going to hold the end of the tape in with your other hand, and then while you're pressing the tape across the top of the foot, you're going to gas pedal down with your foot to keep that tape nice and tight. And then you're going to do 2 or 3 layers of that. So we'll do one more here. Anchor this tape again, same spot, ankle in this position, apply the pressure, press down, and wrap across the top of the foot like so. So that's option A. Option B, I'm going to take that loop or length of tape, pop it in the same position, and then you're going to use your hand to twist your foot in this direction, hold your foot here, apply the tape nice and tight, and then when the foot comes back to the neutral position, it'll have a similar amount of tension that the whole press version of the taping had. So either way works well. The tape, because it's stiff and the foot tends to move, is not going to last over a day or two. So if you get a day or so, maybe 2 days out of this taping method, that works really well. And then obviously if you have any sort of skin reactions, irritation, redness, itchiness, or things like that, take the tape off immediately and don't tape again until you talk with your medical provider. I hope that this is helpful.